Welcome today. Today is a great show. I have the honor and privilege to be here with my friend, mentor, and colleague, Dr. Jason Howe. Today we're going to talk about something that's quite amazing, unique, and something different that most of you listeners will have never heard of. We all have heard of the word acupuncture, but something that is very new and very special is something called neuro-acupuncture. This is something that I personally have experienced myself. I went to a training, neuro-acupuncture training in 2006 through Stanford University. After I finished my medical acupuncture training as an MD, there was a specialty course, and at that time in 2006, I did meet Dr. Howe. This course was something that, in my 18-year practice of integrative medicine, this was one of the defining moments of understanding why I wanted to become an integrative medicine provider and how miracles can happen with doing natural, safe, effective treatments and therapies that have been around for thousands of years, particularly Ayurvedic medicine. And here today we'll talk about Chinese medicine. In that course, I learned how to use a special technique, which we'll talk with Dr. Howe today, about how we can treat neurological disorders very effectively. Things that in conventional medicine has failed or we have very little to offer. Patients like that have MS, they have stroke, they have Parkinson's disease, they have traumatic brain injury, autism, cerebral palsy. In the course in 2006, there was about 40 doctors that attended, and about 12 doctors brought their own patients from the regional area, patients that they've been treating for about 10, 15, 20 years. These were physicians that were 20 years my senior. This was 25, 20 years ago. So at that time, they've been practicing medicine 20 years, had great experience with their patients, but on certain diseases like stroke, Parkinson's, MS, Western medicine has really, in my opinion, has failed. Like the drugs don't really work, and pretty much people can feel confined to wheelchairs with MS or stroke or inability to move. And within that treatment that Dr. Howe demonstrated, everyone, and this is one of these amazing classes that we had as a physician, every patient had a response. And it doesn't happen all the time that someone gets one treatment and they have an amazing response. But this course was like an aha moment. I remember calling my dad, who's a physician for 53 years, and I said, Dad, this is the most amazing thing. It was almost like a hallelujah moment that you'd see in the movies where everybody just gets up and cheers, and tears are just coming out because we've seen patients get out of wheelchairs. We saw patients, who's tremoring just stop. We saw patients be able to speak who weren't able to speak before. And today, later on in our next segment, we will have a special guest, Ula Tinsley, who will talk about her son's response to just about 4 treatments from Dr. Howe. So first I want to do is have Maureen give a little bit of background and introduction to Dr. Jason Howe.
Welcome. Welcome, Dr. Howe. So nice to have you here with us.
Thank you.
So
It'll
special.
be an honor having you here.
It's our honor. So Dr. Jason Howe is a world-renowned doctor of Oriental medicine and is ranked as one of the top 3 acupuncturists in China. For 34 years, he's been teaching, practicing, and researching a special technique called neuro-acupuncture. Neuro-acupuncture is helpful for the treatment of stroke, MS, Parkinson's disease, TBI, spinal injury, PTSD, complex regional pain, phantom pain, cerebral palsy, and autism. Dr. Howe trained in traditional Chinese medicine from the prestigious Heilongjiang University in Harbin, China, where he comes from. He has successfully treated thousands of patients and is featured on TV news programs and documentary films. He's president of the Neuro-Acupuncture Institute. You can find that online at neuro-acupuncture.org. It's a non-profit organization raising public awareness about neuroacupuncture and dedicated to training healthcare providers with his life-changing technique. He's the co-author of the book Chinese Scalp Acupuncture with his wife and partner, Dr. Linda Howe.
Welcome, Dr. Howe. How are you doing today?
Feeling great.
So before we get into your wonderful story, I just want to mention how important Dr. Howe is to the state of New Mexico. For those who are listening, is that this past Friday, which was February 16th, which is also Chinese New Year, right? Is a very auspicious day that Dr. Jason and Linda, his wife, Dr. Jason and Linda Howe, was commemorated by the mayor of Santa Fe, dedicating February 16th now being Dr. Jason and Linda Howe Day in the state of New Mexico for their wonderful work with neuroacupuncture and helping transforming lives. So I just wanted to congratulate you again. It's a great honor to have someone having a day named in our state after.
That's pretty special. Yeah.
So tell us a little bit about your background and a little bit about what made you get into acupuncture, and more importantly, a little bit about neuroacupuncture.
Like Maureen introduced me, I got a year education about Chinese medicine in northeast of China, Harbin, and the University, the Heilongjiang University as the Chinese medicine, is one of the top university specialized neuroacupuncture. In 1989, I was invited to come to the United States to teach this special technique. So next year I'll be here almost 30 years.
Oh, wow.
So teach a lot of workshops, give a lot of lectures, and I think almost 60 workshops we teach. So training a lot of people how to do it.
And we have so many more.
Yeah,
we need to train, right?
Many more people get help to learn this special technique. We can transfer people more lives. So that's the goal we set out want to do about that.
So explain a little bit about acupuncture and the differences between like just conventional. Most people go, oh, I've seen an acupuncturist or a licensed acupuncturist or Doctor of Oriental Medicine. And now there's something called neuroacupuncture, which is a specific technique from you and your university. His university is a place where in China they have that wonderful ice sculptures. And it's just very beautiful. If you ever look at, Google that, beautiful place. But tell people exactly what is the difference between neuroacupuncture and just conventional, traditional Chinese medicine acupuncture.
Acupuncture has been used in China to prevent and treat disease for 3,000 years. Neuroacupuncture is a modern acupuncture technique with only 40 years of history. Neuroacupuncture is a contemporary acupuncture technique integrating traditional needling method with vast knowledge of neuroanatomy, neurology, and neuroscience.
So it's great. It's actually an integrative medicine aspect because most, as a physician, it was very easy for me to learn neuroacupuncture because it was based on neuroanatomy. And so from a Western standpoint, anybody listening who's a Western medical healthcare provider or Western trained in medicine or DO or MD or nurse practitioner, anybody who can handle medical patients and stuff like that, very easy to understand because it's not just looking at meridians, which we traditionally think of as Chinese pathways or energetic pathways in the body. It's actually looking at the neuroanatomy structures and using the special technique that Dr. Howe from his university has been using for now over 30 years. It's something very special because it's integrating Western knowledge of the brain and the Eastern wisdom of how to use these techniques.
That's absolutely right. So it's very easy to communicate with medical professions. Also, it's very easy to educate the patient too, because it's hard for them to understand qi, yin, yang, 5 elements. So they have no ideas. We have some common language. And plus, this indication really is from West point of view too. So that worked well.
Amazingly, it's that we'll be able to help people because in a Western standpoint, we understand paralysis, we understand inability to speak, tremor, and this is something that we can bridge the gap between, Chinese medicine and Western medicine because now we're looking at the terminology of using the same aspect. Now, one thing last week we talked about was the immune system, and I want to give a call to the beta-glucan. We talked to A.J. Langahan, and we want to just mention that for the strongest, most potent beta-glucan that you can use is called Glucan 300. And go to purebetaglucan.com to learn more about the most potent beta-glucan for immune system health. You can enter the promo code PAI for a discount. So now with this use of technique, Dr. Howe's been treating thousands of patients worldwide, and he's been teaching doctors. And we're gonna talk about we created actually since 2006. Since I've had so many success patients in my practice, along with Dr. Howe, we've been sharing patients along for many years now. We had this vision of creating a Neuro-Acupuncture Institute, where we can be a 501c3 nonprofit institute, and we can train physicians and nurses and doctors and acupuncturists, DOMs all across the world, particularly here in the United States now, in this technique. So we want everybody to go to neuro-acupuncture.org to learn more about the classes that will be coming up And pretty soon after the next break, we want to just talk about how we use this technique. And more importantly, we'll talk about to our special guest, Ula Tinsley, about her story. And it's quite amazing because just from a few needles on the head,
correct,
transforming lives. Okay, so he'll talk about this in a minute. We'll talk about how he places the needles, a few of the main pointers, and then we'll hear wonderful, amazing, real testimonial from a wonderful patient coming soon. So hang on, we'll be back after these breaks.
Sounds good.
All right, you are clear.
Okay,
Great.
All right, everybody, we're on Facebook Live. We're here with Dr. Jason Howe, the famous, world famous, along with his wife. Both of them are masters, in my opinion. They're top 3 of all China in terms of this type of technique. And every time they travel around the world, people will follow them in the hotels and places to go because just a few of the needles and the techniques that they use can actually transform and change people's lives. And so we're very happy. Again, on Friday, it was declared Dr. Jason and Linda Howe Day here in New Mexico. So what a wonderful thing. We had state legislators, we had the mayor come out, we had all sorts of people from the business community, patients came out.
Live testimonials.
It was a great celebration.
Wow.
And you know, if we had more time, we have only one person to talk today, but he has thousands of patients that we can actually talk about from a variety of aspects. And we're going to talk about a few of the patients, maybe what we did in Las Cruces and some of these other things that we've seen, very much so.
Sounds great.
Looking forward to it.
All right. And then other thing is, since we're here with our sponsors, just want to give a little shout out to, where's the camera here? pureblack.com. If you want to go purblack.com. Something that improves, it's actually the pure Shilajit. It actually helps improve cell response. So as we're talking about things with plant-based diets, anti-inflammatories like Bosmeric, probiotics, vitamin D, glucan 300, this is now we're talking about a treatment that you can use at home through a provider who's trained in neuroacupuncture that actually can change you or your family's lives. All right, we got a few more seconds, and then we'll be on. So let's talk about.
Seconds.
Okay. I'm not hearing any of the music.
Oh, here we go.
Okay.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Welcome back, everybody. We're here with the famous, Dr. Jason Howe with my co-host Maureen, and today we're going to talk about neuroacupuncture. So let's get right into it. Explain a little bit about neuroanatomy, just real quick for the listeners, and how some simple techniques and simple needles can help people with amazing transformations.
Neuroacupuncture, we use a special small needles. The needles are almost like human being hairs. If you can look at the
if I can show people here, these are not the hypodermic needles that we're all afraid of when we get shots. These are really thin, as you can see. You can kind of bend them here.
Barely see it.
They're sterile. Every needle's sterile that an acupuncturist uses. They use it once and they throw it away.
And they're kind of long too.
So it's very thin, it's very flexible. You can see we can bend it at our face right there. So easy. So it's pre-sterilized and disposable needles. It's very safe. So it's so thin, so small. So most of the time we treat people, they don't feeling it at all. Occasionally they might be feeling like a little bit tingling, maybe like a mosquito bite. That's normal. We treat all kind of neurological symptoms and signs related to neurological disease. And for example, we treat a lot of people have cerebral palsy and autism. If they're less than 5 years old, the kids never see the needles and they don't feeling it. We just play with their hair, like we touch Marie's hair, say, hey, beautiful hair, and we are done. So it's very safe because it's the end of the scalp, inside is a skull, is a bone. So it's most safe technique compared other acupuncture technique. So for a lot of neurological disease and the symptom signs, scalp acupuncture used to called, now we call neuroacupuncture because it brought our technique. So neuroacupuncture have shown mostly effective technique for treat many symptoms related to stroke, multiple sclerosis, Parkinson disease, traumatic brain injury, phantom pain, complex regional pain, and PTSD, and cerebral palsy, and autism. Neuroacupuncture often produces remarkable results with just a few needles.
And it's pretty quick.
Miraculous
It's
results.
sometimes
Wow.
almost in the same session, which we'll hear from Ula in a minute, our special guest. But explain a little bit, because a lot of people don't understand who've never had acupuncture. They're afraid that, okay, they're putting needles, but it's not perpendicular. And actually the needles are going like horizontal underneath the scalp.
Kind of
And it's
threading
in
them
between the
right?
layers of the tissue in the scalp. And so you don't feel it. And when Dr. Howe or I or anybody puts it, it just kind of goes very, very quickly into the scalp.
In our clinic, most of patients we treat have paralysis due to stroke and traumatic brain injury, MS, for example. So we use certain part of the scalp area to treat this disease. So every part of the body have control area in the brain, and the brain have projection area in the scalp surface. For example, from here to here, let me see, from the line here, from here, this whole line control the whole body movement. So people are paralyzed on the right side, the body, the left side, the brain. Right here, they usually have something we can work on that is cause some damage or impaired. And for people paralyzed, their leg, right leg, for example, we just put needle from here to here, and people paralyzed on the arms and the hand, and or we do here, and people paralyzed on the face, or their lost speech right there. So when we treat those kind of patient, needles are very thin there from needle line, probably easy to see. So you just end the scalp, just pull in, and their needle stay there about 30 minutes.
So for the listeners, since they can't see what we're showing here on Facebook Live, is that it goes into specific areas, and all these areas have been mapped out. So there's going to be a place on the scalp for upper extremity motor, lower extremity meaning movement, upper extremity sensory meaning pain or tingling or numbness and neuropathies. There's going to be parts for speech, parts for vision, parts for the availability to intonate and move or swallow. So there's parts on the scalp that correlate with the brain, and basically what he's doing with the special technique, which you will learn if you take if you go to neuro-acupuncture.org. If you're a practitioner, there's upcoming certifications where you can go through level 1, 2, 3 trainings and then get certified in neuroacupuncture to teach these techniques. Now,
so do you do the scalp as well as the body?
Yes, most of them are the early stage. A good question.
Mm-hmm.
So we do that on the scalp first.
Mm-hmm.
And a lot of people, they're just fine. Like they never speak, and you put needle there, they talk.
Like one needle.
Yeah, well, two.
So you're not covering the whole head in
no,
needles
1, 2,
either.
and mostly or 3. So they can talk right away, like autism or the people lost of speech.
Yeah.
We don't need to put a body acupuncture. But for people paralyzed, they move the arm better, but they have hand a little bit tight still. And later on, we might be put a few needles on the hand, arm, then we stimulate. Put the needles in the head, we stimulate central nerve system. And for the arm, we put needle stimulate peripheral nerve and then recover a lot of things. Yes, sometimes we do.
And when he puts it on the scalp, he'll twirl the hands, and that's part of the technique. Is they twirl the needle back and forth, which stimulates like an electrical current from the positive electron ions, and it's actually like almost like an electroacupuncture, but actually physically doing it from the body. And it's about 200 cycles per second. Am I right? Right. So this guy's a master. It's like
per
minute. It's like per minute. So this is like Bruce Lee. Okay, and the scalp.
So you have to do there the fast you do to get the best results. So that's recurrent practitioner do a lot of meditation, the yoga, Tai Chi, Qigong, and make their body stronger. So when they are treated patient, your technique, your energy is transforming from needles and through the skull and the regular inside the brain functions.
My first patient that I actually, when I finished the course in 2006, she was a paraplegic, 26 years, had a car accident in California, moved to New Mexico just due to the cost of care. And, I did a treatment on her and I said, well, do you feel anything? She's like, I feel some kind of electrical tingling. I was like, okay, well, this is my first time doing it. You might have to go see Dr. Howe, but I know that there's going to be some response. He basically did a treatment every 2 weeks for about 3 to 4 months. And now she walks without a cane or a wheelchair. And so we've seen patients with MS, Parkinson, stroke, people who've been, 20 years, 15 years, 10 years, like one side paralysis, not able to lift their arm or to brush their teeth, and literally within a few treatments get out. One of the jokes that we have actually is that we wanted to open up a used medical supply store because there's so many wheelchairs and crutches and things that people come in, and when patients always share these stories, like when they go to Dr. Howe's office and Linda Howe's office, we'll see all these people walking in with some kind of disability or a traumatic injury, and then they're walking out, and it's just quite a miracle.
Yeah, I'll give you another example. People, if they don't see that, you probably don't believe that. Last week we treated one female lady, and 73 years old female. She had stroke 7 weeks ago. She paralyzed left side and cannot talk clear, and so arm paralyzed, the leg in a wheelchair. In second treatment, he walking with a walker.
Wow.
See?
Just one treatment,
See?
4 needles, the life completely shifted.
So
let me
get up and walk away from a treatment would be amazing.
How important is this that some people, like, for example, if you go to Sanjevani.net, that's SANJEVANI.net, you look up Neuro-Acupuncture on our page, because we put up a special report that was a investigative kind of medical report on a television show that will show about 30 minutes of interviews of what was on Fox affiliate, Randy Travis, the singer, the country singer that we all know in New Mexico, who we all love, who like country music. He had some dramatic brain injury and some stroke, and your wife actually treated him, and he was able to go and sing at the awards, the country music awards. So again, it's for everyone, from children to adults. It's quite an amazing thing that we can see, and we all have wonderful patients who've come in and had miraculous. I mean, it's almost too good to be true.
Well, I have a quick question for Dr. Howe.
Sure.
What if someone wants to come and see you?
Oh, they were happy patient. Or we take a couple of months. We are whole booked.
Right.
So if you plan to come, and make sure you come here and give you 3 or 4 months. And the people from local, we treat them once or twice a week. People from out of state, from out of country, and they usually come here a week or 2 weeks, and some people a month. So they usually get treatment, 4 treatment weeks.
Wow.
So a week. So and many of them can come in a wheelchair. They just can walk home.
Right.
People probably don't believe that, but
It's true.
That's
We've
3
seen
years
it.
ago. I have to back to school to learn how to make a film.
Right.
So we document patient before, during, after treatment. So there's a lot of movies there on the YouTube.
He has hundreds of videos, and actually we're putting together some presentations. And on our website, sanjevani.net, you go to Neuro-Acupuncture, you'll see our next guest who will be coming after the break soon, Ula Tinsley, and she'll tell her story. But we've uploaded some of her videos of her taking herself. None of these are doctored. None of these are Photoshopped. These are real, just iPhone photos or whatever, smartphone photos, videos that she's taken. And we have hundreds of these things. Eventually, you'll see again on our neuroacupuncture.org page as well as sanjevani.net on neuroacupuncture. There is a video there that is actually done from the television station. So you want to see that because you'll see veterans with traumatic brain injury coming back from Iraq and Afghanistan, patients with PTSD. I mean, once you just see these little clips of patients before and after, listening to the moms and the parents of these patients, it's just amazing. I can't express how important this is for people to look at and ask their providers to go to neuro-acupuncture.org, sign up for a class. And when we come back after this break, you will hear an amazing mother's story about her son's treatment with autism with neuroacupuncture from Dr. Howe. And we'll be right back.
All right, you're clear.
Okay. All right, it's going quick. So guys, okay, we got 2 more segments. Ula, go ahead and unmute you, and we will then
Hello, Ula.
hi, we'll bring you back in this next segment, and then I want you to Maureen, I'll just give the introduction.
Sure,
and then we'll just go from there and have an open discussion. I know we're kind of going really fast. It's going quick. So we got
I know we have all these questions, but we're just like flying through things.
No, I think they flow pretty good.
Yeah.
it's just good because I want them to hear the story, because again, they won't understand. It's hard because they're listening, they can't see. But basically, for those people who are watching right now, there's parts in the scalp, and each part, which when we go for the training, we'll explain what parts for what conditions. And I highly recommend. It's so important that every patient can have the ability to eventually one day see a provider that can get this type of treatment. It's safe, it's effective, and then we'll talk also on the once the show comes back about Walter Reed. We'll talk a little bit about all the things that we've been doing wonderfully, and how we're going to look at publishing more data and studies, and maybe the treatment in Las Cruces at the medical school and the kids singing.
Yeah, anyone have questions? You probably need to have this paralysis and aphasia, kind of speech loss of balance, kind of memory, things, confusion. You might be talk to your acupuncture. They probably don't know how to do that.
Yeah, most people in the United States don't know that everybody's been trained in acupuncture, but this is a special technique that nobody really has known. And so the acupuncturists can come to the courses because there's courses from MDs and DOs, and there's courses for acupuncturists and doctors of oriental medicine. And you get certified, and then once they get certified, they go through levels of training. They will be then listed on their website.
Back in 10 seconds.
As a provider, it's a great way for them to get patients.
Correct.
All right.
Mm-hmm.
All right.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Welcome, everyone. I just want to get right into this next segment because it's super exciting. We have a special guest here. Her name is Ula Tinsley. She's a patient of ours at Sanjevani who we met via Facebook maybe 2 years ago, just chatting. She has a son with autism. I'll have her tell your story, and Maureen give the introduction. But just want to let you know is that she ended up coming out here, and what an amazing story. What an amazing story still in progression. So Maureen, go ahead and just give an introduction to our special guest, Ula.
Not only is she one of our patients, she's also one of our friends. Ula Tinsley, MSc, better known as Ursa, Autism Mama Bear, is an autism advocate and featured writer at www.icare4autism.org. She's been raising autism awareness on local and national levels since 2010, when her son Michael was diagnosed with autism. Since then, Ula has been participating in autism conferences and seminars, gaining more experience and knowledge about different ways of treating ASD. She's been consulting other families living with autism. Last October, Michael took part at the Neuro-Acupuncture Institute training seminar as a patient of Dr. Jason Howe. After just one session and 3 needles, Michael was calmer and more alert. After 4 sessions, he was counting, reading out loud letters and numbers, forward and backward, drawing and playing with his sister, and simultaneously saying hello to his teachers and friends for the first time. The Tinsleys can now enjoy eating out in a restaurant, going to church as a family, and having guests over without Michael having a meltdown.
Welcome today, Ula. How are you doing today?
Hi, thanks so much for having me on your show.
So please tell us a little bit about Michael's history just shortly, and then really get into what happened when Michael, when you and your family drove out for the treatment.
Oh my goodness, that's like crazy story. It's how God orchestrated everything. You know, Maureen just mentioned that there is this training, Neuro-Acupuncture training coming along, and that there is a spot for a patient with autism. So perhaps we would consider maybe getting together with Dr. Howe and getting Michael into the program. And so, of course, I did more research on neuroacupuncture, and I was like, wow, I mean, people with paralysis, people after stroke, getting up and moving again, people who lost their limbs and have this phantom pain, and you are helping them again with that. But then I was like, what about autism? You know, show me someone that actually was helped through neuroacupuncture with autism or any other autism spectrum disorder condition. And so then I found other videos, other testimonials, Dr. Howe and Dr. Linda Howe also helping patients with autism. Logan, another patient. I mean, it's amazing. We came to Santa Fe. It was just really a miracle how it all came together, the plan. We met Dr. Sunil Pai, Maureen, and Dr. Howe. We were part of the program. Of course, Michael was overwhelmed with all the audience and everyone there on the stage, but he really wanted to be helped. And we were telling him about the program. We were explaining what's going to happen to him, that there will be needles, but it's not going to hurt. And those are our friends. He understood everything and he really wanted to participate. Yes, at first he was scared, but like Dr. Howe mentioned, kids don't see the needles. They're so crafty that just hiding the needles, you cannot really see the needles. So Michael thought that Dr. Howe was just playing with his hair, with some cotton ball, you know, just putting on top of his head. And when the first few needles came in, because Michael came in very anxious, and a few minutes later, just
yeah. So Ula, can you tell the listeners, because they don't know Michael, what was his behavior like before that? So can I explain from a mother of a child that has autism? You know, what have you been? You know, how has he been before the treatments?
And how old is Michael?
Well, Michael just turned 11.
Uh-huh.
He is nonverbal. He was diagnosed when he was 3, and basically Michael stopped speaking when he was around 2 years old, and he lost a lot of his skills, like social skills and keeping eye contact. And the speech was a big loss because he used to speak 2-3 word phrases and he lost it completely. He was drawn. So when we heard about neuroacupuncture, we wanted to try and see if it will open up Michael and make him more verbal. We didn't expect that he will quote Shakespeare right away, but we just wanted to see some improvement. Michael was developing normal until, like I said, around 2 years old. And then he started getting more frustrated because he couldn't communicate his needs and wants with words. So we didn't read his mind, obviously. And we were trying to find ways to teach him different ways of communication, like picture exchange, communication system, and a basic sign language. But again, it decreased just a little bit of his anxiety and frustration. Then his bowel movement was horrific. Sorry, I don't know if I can say it on air, but he was not digesting food properly. Basically, whatever he put in his mouth and how much he chewed was coming out the same way, pretty much. And he was suffering a lot. He was cramping in his stomach. He was screaming, waking up during the night. Actually stopped sleeping almost completely. So for 2 years, we were zombies. My husband and I, we were just waking up and doing shifts. Several hours every night, and it was just a misery for all of us. Then I was pregnant with our baby girl, who is now 7, And that was another burden. And then Michael was getting more anxious, starting school. We couldn't go out anywhere. I mean, we were living like prisoners in our own little house, because when we were going out to family gathering, it would be just Michael screaming, "Ah!" and demanding attention, or the light or the smell. Everything would be just bothering him. All the sensory overload, full blown. We were going out to restaurant, and usually my mother-in-law or I would step out with Michael, because Michael wouldn't be able to sit in the restaurant. He would be just getting tantrums and then growing into meltdown and completely losing it. So I would have to go out with him, put him on the floor and just ground him and calm him down. And it was very tiring, as you can imagine.
Now I have to tell the listeners that, as a mother of a child with autism, Ula has explored everything. And, they went to all the best specialists around the world in various clinics. They've tried different medications, from prescriptive drugs to natural therapies. And still, this was the behavior. So as a frustration, some people can go and try different things and they get some response. But on the whole, most people don't have much response. And that's why the continued frustration of, autism is because there is not something that can really be a game changer. And in my opinion, what we've seen with Dr. Howe and neuroacupuncture is that it is a game. There is certain things that can actually improve certain quality of lives, which are game changers for parents who have to undergo this child who's very, can't communicate well. So explain now, after he came into the room, I remember, he was really combative, and your husband, who's a very big gentleman, was able to kind of hold him and kind of calm him down, because there was about 40 people watching, and we had cameras. And then when we gave him what the acupuncture treatment, explain a little bit about, again, what immediately happened to him, and then what did you see serially the next couple of days after several treatments?
Yes, I mean, the first, he was very anxious because of all the situation around him, but also the needles. So first needle, he was crying because he was scared and he felt something. Like Dr. Howe mentioned, it could be like a mosquito bite sometimes. And probably he felt that. But then the second needle went in, and immediately Michael just calmed down and waited for another one. So another one went in, and Michael was like drunk, sitting on the chair, just in complete zen, relaxed, looking at us, smiling, looking around, smiling to Dr. Howe as well. And then we were asked to go for a walk in the garden and just take it in and keep the needles in. So we took him out for a little walk. He was swinging on the swing in the garden and just relaxed. And we're like, wow, we can really enjoy this walk, in the park with our son.
And he was singing on the swing. I remember he was singing songs. It was so great.
And if everybody goes again to sanjevani.net, okay, and you look up Neuro-Acupuncture on our page, we've uploaded Ula's videos. And so they're all up there. You just have to click on it, so you don't have to enter anything. And you can watch the progression in real time, like what he was like before, what he was like during the treatment. And you can actually see it. It's an amazing change. And most people still, unless you have a child or someone who has autism, don't know how difficult it is to go to a restaurant, to go to church, just to go out in public, and to see this from a simple treatment that Dr. Howe gave was quite amazing. And to see your expression, your husband's expression, your daughter's expression, and the communication in real time of like, oh my God, my child is doing this. So what did you see after the second one, third one?
I noticed too how Michael really took to both Dr. Jason and Linda Howe. Just the way they treated him, he felt very comfortable with them and was hugging them and holding them, and that was really awesome to see as well.
Yes, I mean, he immediately, even socially, he was aware of other doctors in the audience. He was aware of Dr. Linda, and actually during the break, when Michael still had his needles in, we were walking around, and Dr. Linda smiled, and Michael just went to hug her, and then she just wanted to fix the needles that were sticking out, and she just did a little twisting, very fast twisting of the needles, and Michael put her hand back, and more, I want more, because it obviously stimulated some areas that it was good for him, and he felt amazing. So yes,
and I remember him counting, all of a sudden counting
using his hands. He has never done that. I mean, maybe when he was a little baby and we were showing him, but he lost this ability, and then he was just 1, 2, 3, 4 on his fingers, and then Dr. Howe made him count backwards. Like, no, he doesn't know how to count backwards. And doctor said 10, 9, And Michael, 8, 7, 6. We're like, whoa. That was like
these are things that when you see that, it brings a tear to everybody's eyes, because again, many people who don't have a child would not understand that these are big things that make, the ability to express themselves when they have a little bit of pain, or they're hungry, or it's cold, and anything that can help their quality of life is a huge change in everybody's quality of life. Your quality of life, the daughter's quality of life, your husband's quality of life, the school's quality of life, everything. So after this break, what I want you to do is I want you to tell everybody what was the third or fourth treatment, and then more importantly, once you went back home, what happened at church, what happened at school. Okay,
right.
So everybody hang on, because it's a great story. More to come after the break here.
Stay tuned.
Stay tuned. We'll be back.
Very interesting story.
All right, you're clear.
Okay. All right. So then we'll just talk a little bit more, and then we have to get you to talk a little bit.
No, pretty good. I enjoy it.
Just I want people to really get the story, because it's easy. Everyone, please go to sanjevani.net. www.sanjevani, SANJEVANI.net, and look up the part on the home bar. It says Neuro-Acupuncture. All the videos are uploaded. Please watch them, and then we definitely want you to go to donate to the neuroacupuncture.org, neuro-acupuncture.
There are some comments already on Facebook Live, I see.
Okay.
My friend Candice, I believe in this, as I have witnessed. God bless a mother who refused to give up. Yes, thank you, Candice.
Wonderful.
And also Miss Linda, thank you for allowing us to witness Michael's progress. What a blessing. Yes, it is.
It is
Christy,
a blessing.
my friend,
all of
so
us.
beautiful and amazing. That's it. And I was going to ask, because obviously neuroacupuncture works for all kinds of neurological disorders, but what about like brain tumors and
the brain tumor, the acupuncture, we cannot treat the tumor, but a lot of people have tumor removed, and then also tumor himself cause any neurological damage, and they have wonderful results.
Yeah, we usually see, like you said, that when they have the tumor removed surgically, then it's almost like having a stroke or certain damage to the brain, and that we've seen people gain back their speech, their ability to walk, their balance, and all that. But it's not treating the tumor directly.
Right.
Okay.
Right. Thank you very much to share your stories. There's a 21.7 million.
Back in 10 seconds.
Keep going.
Have the autism.
We'll wait till that comes on right here.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Okay, we're here with Dr. Jason Howe talking about neuroacupuncture, and our special guest also Ula Tinsley talking about her wonderful son Michael, who had some amazing results. But Dr. Howe, you're just mentioning how many children now are diagnosed worldwide with autism?
There's 21.7 million.
21.7 million
kids have the autism.
Okay, I think it's like 1 in 34, 1 in 43, something like that. It's just, that's a whole other show discussion of what might be the triggers. One of the things that we'll talk about just briefly after you finish, though, is what are the other things that you did also, Ula, to help your son maintain and keep these improvements. So stage 3 and 4 treatment, what happened?
Right. So, like I said, Michael started being more sociable. He was finally interacting with his baby sister, because before she was playing with her own friends or playing her toys, and Michael was always in the corner alone, just drumming in the little corner. Now he's actually, after the 3rd treatment, he was drawing on the same piece of paper with Vivian. Whatever Vivian was drawing, he was copying.
Wow, that's so amazing.
And then whatever Michael drew, she was trying to copy, and he was just checking if she did it right. I mean, it was amazing. So both me and my husband were just crying, tears of joy.
Right.
And truly, it's a miracle. It's a miracle. And we came in a little bit skeptical, I must say, because we didn't know what to expect. We were familiar with acupuncture, the traditional acupuncture, but not familiar with neuroacupuncture. And then after the 4th treatment, and when we came back home, spontaneously, I was like, Michael, what do you want to eat? On the way back home in the car, I was just turning around. What would you like to eat? And Michael, apple. I'm like, ah, oh my goodness, say apple. I'm like, apple, apple, apple. Pronouncing so clear, and both me and my husband and even Vivian, yeah, well done.
Yeah, to hear first words of a child at 11.
Yes, I
It's
mean,
just, I can't imagine. I mean, I just hearing that just kind of cheers me up, because it's just like,
giving us our son back, giving us his voice back.
So what happened when he came back to your hometown? What did the people think? What did the school think?
Yes, he went back to school. The teachers immediately noticed the difference. And if the teachers are watching, hello, they told me to make sure that I mention Michael came into the classroom and normally just going head down or hugging his teacher, and that's it. And here he just said hello or hi, spontaneous. It's like
blew their minds, I can imagine.
A social butterfly that he was, And we started going to church, and always me and my mother-in-law were in charge of looking after Michael. We always had to step out because he was too noisy, getting too overwhelmed with sound and I guess echo, maybe the light. And now we're just sitting through the whole service in the church. We go to restaurants, we sit in the restaurant, we enjoy our dinner, we laugh, the regular social gathering. Michael sits with us. Michael had birthday in February, just a few weeks ago. And we're just sitting together as a family at grandparents' house, not our house where we have everything, like a jail, everything secured. No, at grandparents' house. Amazing. And he had fun. He enjoyed, having his cake. It's amazing.
So what else have we done with Michael in terms of, I think for most people listening, from using an integrative approach, we're using this amazing technique that Dr. and Jason and Linda Howe use called Neuro-Acupuncture. Again, neuro-acupuncture.org to learn how to get that treatment, or how to, as a provider, to get trained in those treatments. But then other things that we see integratively that we've worked on is looking at your gut microbiome of your son, right? We talked about that in previous episodes, but looking at, the leaky gut, looking at food allergies, looking at, keeping the probiotics and keeping the immune system strong. These are things that all autism kids usually have, some kind of gut dysfunction, whether it's glyphosate, whether it's food allergies, whether it's just antibiotic treatments, everything has caused dysfunction. So the wonderful thing about integrative medicine is that we're not just using a single treatment or a single herb or a test. We're looking at how do we improve a variety of parameters in the patient's life, which is then changes everybody's lives.
Oh, yes. And I am so glad that you guided us to do those tests, very deep, detailed tests, because we knew that Michael had allergy. We did some tests in Cyprus where we lived over the years, and it showed that Michael was allergic to a few things like dust mites, dairy, gluten, which is very common with kids on the spectrum. And so we were always keeping the diet, trying to keep the diet gluten-free, dairy-free, and as healthy as possible. But then I did some research on healthy living, healthy diet, and I wanted to make sure that my family gets all the best. So I was starting the day with a green smoothie. I was putting kale, chlorella, spirulina, and so on. But as a base, banana, then some kefir or yogurt, because it's healthy bacteria with probiotics, right? And stuff like that. Sometimes grape juice to sweeten, not to put any sugar or stevia or anything else, just grape juice. And of course, we found out that Michael is highly allergic, because I was wondering why he's not getting better, why his bowels are still, messed up. What is going on? What can I do to improve? And then with Dr. Sunil Pai, we discovered that he's got allergy to yogurt, to bananas, to grapes, honey.
Everything you were putting in there.
But once you removed it,
once I removed it, it was amazing.
Right.
He slept through the night. He was just completely a different child, and his bowel movement got back to normal. It's no longer an issue. I mean, okay, every now and then when he gets something like at school, school lunch or something, it affects, but it shows again the correlation between his gut and the brain.
Right.
It really affects what we eat. So yes, then we started adding supplements, probiotics and fish oil and different things, and replacing our smoothies with the vegan protein shake, which you can get at
Right. So
Sanjevani.
everybody who's listening, they're eating an anti-inflammatory plant-based diet. They checked their food allergies. They did microbiome testing, and they came and got an amazing, game-changing, life-transforming treatment, neuroacupuncture from Dr. Jason and Dr. Linda Howe here in Albuquerque, New Mexico. What an amazing story. I really appreciate you coming today and talking to us about this. What I want everybody who's listening is that if you have a medical provider that would be willing and interested, who's holistic or an acupuncturist or doctor of oriental medicine, go to neuro-acupuncture.org and look at these courses. There are 3 certification courses, level 1 through 3 training, and it happens like twice a year. And if you come in, you get to study with the master and wonderful teachers that we have. We have a Neuro-Acupuncture Institute, and if you can go there, you can see all the different faculty members and what the course is. And also, please donate to, it's a nonprofit, so you get a tax deduction on that. And another way to donate is if you go to Amazon Smile, and you can pick Neuro-Acupuncture as your charity of choice, and then anything that you buy through Amazon Smile, which is just basically Amazon.com, anything that you buy that is a certain purchase, 0.5% will be donated from the Amazon side, not from your side, from your purchase to the nonprofit charity here. So this is going to help us because we need funding so that we can train more doctors. Our goal is not everybody coming to Albuquerque and waiting 6 months to get seen by Dr. Howe or by myself. Is what we want is that we want to train. And one of the best things that I love about Dr. Jason and Linda Howe, instead of being the ancient Chinese secret that we always kind of typically say, is that they're here willing to share with the world, just teaching it appropriately so that we can credential everybody in the technique and making sure that's delivering appropriately, how to get the skill in doing the evaluation, the exam, and the treatment. So it's just an amazing thing. I'm really happy that we were able to provide this service today of listening to everybody, that this is something that you can do.
And speaking of training, what city do you live in, Ula?
Valdez, North Carolina.
North Carolina. So any providers in North Carolina who are listening to this, you already have a patient there. And anybody who wants to really open up a practice for MS, Parkinson's, traumatic brain injury, autism, stroke patients, and cerebral palsy patients, I mean, these are patients that we don't have any treatment for conventionally. So if you want to have a booming practice and help wonderful people, this is a great thing. Neuro-Acupuncture, neuro-acupuncture.org. Go to sanjevani.net and look up Neuro-Acupuncture. Watch all the wonderful news reports and all these wonderful videos, and we will definitely, any last words you want to say?
When's the next training, Dr. Howe?
It will be April.
April.
Yeah.
Okay.
So we're close.
So coming up April 2018 here in.
And there's still spots available?
In Santa Fe and Albuquerque.
I can wear a few now, almost a whole book.
So
Okay,
please
hurry.
take a look. And everybody, again, we want to thank our sponsors, beta-glucan. So glucan 300, go to pure-beta-glucan.com, and also Pure Black for improving your cell response and energy function, memory function, and healing. Go to pureblack.com. And again, until next week, everybody, take back your health and best of health.
Thank you very much, Ula, to share your stories and make a story. So that information pass along, work, save a lot of family, lots of kids' life. Thank you.
Thank
so
you,
much.
doctor. Thank you.
Thank you so much.
Thanks.
All right, we're clear.
Okay, everybody, we have about 5 or 10 minutes. I don't know if you, is there any other questions since we're on Facebook?
Dr. Pai, real quick, while I've got you guys on here, just next week when we start, let's connect to Facebook a little bit sooner before we start, because once you guys connected, it compressed the sound pretty bad coming to us, and we started getting some distortion occasionally. So let's next week, let's connect first and then do our sound test. That way we've got everything.
So do you want me to connect to Facebook first, or you first?
Us first, and then we'll connect to Facebook before we do our sound test. Just because, I think it's just the RAM on the computer starts taking up more RAM when we're connected to both, and I think it compressed that sound down pretty bad. So we'll connect next time Facebook and get everything going before we start the show.
Thank you.
Otherwise, though, you guys, great show, sounded good, ton of good information. You guys have a great day.
Thank you. All right, let's see, is there anything on Facebook that we can see? Any questions? Do you see any questions there?
Depression and anxiety.
Yes. Do you want to answer that? Depression and anxiety?
Where are we?
That was a question from Candice.
Candice.
The depression and anxiety is very common in the clinic, associated with many different diseases. And mostly there's anxiety and depression, it involves the front lobe and temporal lobe. So that part of the brain needs to function better. In clinic, actually, one out of 3 points in top on the head, right simple, people can feeling anxiety release right away. It's very effective. And depression, usually we put here and the temporal lobe here control the depression and worked well.
Yeah, my dad had a patient just before he retired, and she had a family member which unfortunately committed suicide. So she had, I think it was her son, and she was, depressed, rightfully so, for many, many years. And just couldn't get out of it, was treated with medications and all. And before he retired, he invited Dr. Howe to come down to the office. We're doing some demonstrations for our state legislator. And literally within that one treatment, like things just started to open up, and she's been different since, and she just kind of broke the funk of the depression without any medication. So it can be very helpful for depression and anxiety. We use it a lot for PTSD. We also use it a lot for people who have restless leg syndrome, those kind of things like that. Wonderful, wonderful. Just general primary care things works, but for the neurological problems, even better.
And you guys were going to talk about some of the miracles that were performed down in Las Cruces.
Yes. So for the people who are listening, this is this like a few more stories. We did have a demonstration to the Burrell College of Medicine in Las Cruces. We went down and we did a demonstration to the in the auditorium of medical students and staff members there, and we had a couple of nonverbal autism patients. And one of them, which is very interesting, who was nonverbal, I think he was 7 years old. After he did the treatment, he started to sing "Happy Birthday" because he had a twin brother, and they had a birthday a week before. Was nonverbal, and then once Dr. Howe put the needles in, he started to sing "Happy Birthday," and then with the whole auditorium sung "Happy Birthday" with him, back and forth, and everybody was in tears because like parents have never heard him speak. I think now the last time they went to you, I believe it's almost about 80 words now in his vocabulary from none. I mean, these are, again, everybody is like, yeah, he's not going to be reciting Shakespeare, but these are huge game changers that it will improve quality of life for taking care of a child, or the child taking care of themselves and expressing themselves. And we've seen patients with stroke again, paralysis, even in from car accidents, not able to stand, and then within 1 or 2 sessions, and we've had this on video within state legislator people in present because they were bringing their family members. And so we're looking at how we can really share this. And this is one thing that we want everybody to continue to donate, because when they donate, that will help us educate, document. We're actually having some ideas of looking at doing some clinical published studies so that we can formally look at how this might be working. We're not really sure exactly all the neuroanatomy aspects from a Western standpoint. From an Eastern standpoint, they can explain it. From a Western standpoint, we can't. But right now, results is what matters. It's safe and it's effective, and people are changed immediately. So why not do it? Right. I think there was
and no side effects.
No side effects. Right. And one thing is, like, Dr. Howe was invited many years ago to go to Walter Reed, and it was a part of a study of looking at phantom pain and pain from patients at Walter Reed coming back from Iraq, Afghanistan, traumatic brain injury and loss of limbs. Phantom pains when someone has a limb that's lost due to an injury, and there's an extreme pain as if the limb phantomly is still there. And most of these men and women, who have served our country, they're in extreme pain. They're on IV morphine drips, and they're still crying in tears of pain. Mm-hmm. They're taking tons of antipsychotics, tons of pain medications, neurosat, and it just never gets rid of the pain. And they had about 40 so neuroscientists and doctors from all the military. And Dr. Howe was part of a kind of a science group to do the treatment. And it was, I think, 6 out of 7 or 7 out of 8.
Yeah, after only one treatment. During the one treatment, we treated 7 for demonstrations, 3 instant no pain.
3 instantly no pain, no 1 treatment.
Clear,
These are people clear. With IV morphine drips, 10 out of 10 pain scales. Boom, 1 session, 3 gone.
Yeah, have 3 significant better. It's still just reduced from pain from 10 to 1 or 2, and only 1 not work. After only 1 treatment, year 2, 86% success rate.
Wow.
Is very high.
Right. We don't have that with any other kind of procedure or drug. So the second treatment, 86% reduction in pain. And so it was amazing. Now, one of the things that we have a little bit of that we get trolled upon in integrative and Chinese medicine and all this stuff is because people will come in and say, well, Dr. Howe, explain to us, how is this exactly working? You know, we get it from the neurologists, we get it from the psychologists, the neurosurgeons, all these people. And our response is, hey, you're the world's famous neurologists and neurosurgeons. You tell us how this works, right? All we know that from from history and from technique and from seeing thousands of patients, we know that it's safe and effective. But again, we're not here to prove we know something better. We just knew something that's different, and we need to be open to looking at trying integrative, natural, complementary, and what I consider traditional medicines. Remember, conventional medicine is only a couple hundred years old. This stuff goes 3,000 years back. Chinese medicine, Ayurvedic medicine, and so I really want to express to everybody that we need to start opening our minds and not living in the box of it's only a pill that's going to help us get better.
Yeah, also we are looking for the scientists or the neurologists, so we can do some collaborative work, do the clinical trial research, and when we get funding, get granting, so we can more discover this mystery, what going on happening. When we put needles, the paralyzed immediately move, they cannot talk right away. Something happening inside the brain.
And it's amazing. So anybody who's listening who's a neurologist, who's interested, a holistic integrative neurologist, someone who wants to be in a game changer, to be world famous, right, is they should contact the Neuro-Acupuncture Institute.org and say how they can participate. We're going to be getting funding eventually soon that we can do some more research. We also want to do like functional testing, like functional MRIs or anything else that we can show changes in the brain patterning. But again, anybody who wants to participate, we're always looking at, integrating and learning. We already have set up a clinical trial. Basically, we're just waiting for funding. So we already have like neuropsychologists and behavioral specialists, and if we can get a neurologist on board. Recently, we just added to our board of directors Dr. Valerie Leggett from University of New Mexico, who we really enjoy, and she will be introducing we already did a presentation to the university last year, which was well received, but now we're going to be looking at doing ground rounds at the hospital, right, with neurology, with the pediatrics department. If we can train residents and fellows, then in every department, from a pediatric to a neurologist to a family practice internal medicine, we all have patients. So if someone's saying, I'm kind of getting bored of just writing prescriptions, this is something great to add to your skill, because it's something that gives me as a physician great. I mean, he gets this every day. He gets hundreds of patients, and so for him, it's like, okay, they're walking and talking enough. But for me, as an integrated physician, when we look at chronic disease, it takes a long time to reverse. It does reverse, but it takes a long time. And when you do a treatment where instantly people get benefits and they walk out of your office saying, my balance, my speech, my dizziness, my tremor is better, it's just a great satisfaction of being a healthcare provider.
That's correct. For example, we treat one lawyer in our board, and he has 20 years multiple sclerosis, 12 years disabled, severe fatigue, loss of balance, cannot see, cannot function. After 3 treatments, complete clear. After 4 treatments, he back full-time job. That's huge. So it's just one example.
Yeah, and so
we can repeat
and I want to repeat what he said, because this gentleman, who's really smart, he was a lawyer. He had a big practice in my hometown in the southern part of the state in Las Cruces. He had his own firm. He's been practicing, and he was my dad's kind of did some contract work for him and estate planning and all that stuff. And with having the MS for many years, it was kind of disability for him, and so it's having more and more difficult vision problems. Then he couldn't drive, he couldn't go, and so eventually he had to basically sell his practice and then work for someone else, even though he built the whole business himself from ground up, right? And I told him once to say, hey, you should go get this treatment. He didn't believe me. And then my dad told him, he respected even more, because my dad's known him for 50 years. And my dad said, you need to go see Dr. Howe. And literally it changed his life. And then not only did he get his vision back through ophthalmology, visual field testing, all back, he can read. He's no longer on a cane. He's walking. He got back to drive. He went back to work for 2 years. And now he's on our board. He's for the nonprofit. Again, so these are all people coming, usually we're conservative, usually from a different field. Everybody can benefit from neuroacupuncture if you have this. And you don't have to be a believer, you just have to experience it.
Yeah, basically you believe that, you're going to see that they're happening in our clinic every day. And my wife's clinic. It's very rewarding to the people, life transforming, and change the society and change the family lives. So Thank you.
So, all right, everybody, this is going to be the end of today's episode. But again, I just want to call out a couple of websites. Sanjevani.net. Go to Neuro-Acupuncture, SANJEVANI.net. Look up Neuro-Acupuncture. Look at the Globe Dragon special news report. That talks. It's called Global Dragon.
Global Dragon.
Right.
Global Dragon TV special report that they just have an interview for us, and they're on the air YouTube now. There's all kind of disease. Basically, all the patient, they found that they go to internet, they pull all the patient. A lot of patients put their story there. They put together. Very, very encouraging to see.
Watch that. Look at Ula Tinsley's. We uploaded all her videos, and we'll have more coming soon. Eventually, we'll probably make a small mini documentary film of that. And then go to neuro-acupuncture.org. Learn more about neuroacupuncture. Again, please help support, donate when you can, and go to Amazon Smile. Pick Neuro-Acupuncture as your charity of choice. So when you buy socks and shoes and anything you're getting on Amazon, a portion of that will go help providers and help us train more people.
And go to Ula's website as well. Yes. iCare 4 autism.org.
Yeah, and again, it's great to connect with parents of children with autism, because you need to hear it from them, right?
Yes.
Ula's a great example, and then from her story will transform, because more and more people will hear about that. It's easy for doctors to say, hey, we got a treatment, but then most parents who have autism kids, they've been to hundreds of doctors. And so it's really I really appreciate you taking the chance with us and traveling all the way, driving in the car all the way from North Carolina to Albuquerque.
It was fun.
And appreciate you meeting your whole family. And thank you very much for joining us today.
Thank you so much.
All right. Thank you, everybody. And again, best of health, and we'll talk to you next week.
Bye.
Bye-bye.
Bye.
Oh, yeah.
All right, everybody.
Peace.
Peace.